That's fine.
If you're watching Dr. Haque right now, he's an absolute genius, and he's a comedian, he's a genius, he's an awesome character. You'll love this session, I'm sure. So yeah, it's Doc, it's actually 11:30 right now. So I am going to take the liberty of welcoming you onto the stage, welcoming you to the event today. We have lots of people online as we speak. There's our Facebook attendance is going up as we speak. Lots of people are watching on there. I'll be monitoring the Facebook questions and I'll feed them to yourself as we go along. So Dr. Enam Haque, welcome to the conference. It was wonderful having you last year, so it was lovely to have you again this year. Just for our audience, I guess, if I could kind of welcome you and introduce you perhaps. You are a senior lecturer at Manchester University. You are also the academic lead for widening participation at Manchester Medical School. We're very proud from within the Northwest that you are the chair of the National Medical Schools Widening Participation Forum. So it's an absolute pleasure to have you, and I'm going to hand over the floor to you. Welcome to the conference, Dr. Haque.
Thank you. Thanks, Abdul. So first of all, I'd like to thank Blue Peanut, Dr. Zimran and Abdul, and the team behind it. They've been doing some amazing work with widening participation, particularly in regards to the Northwest. So it's great they're doing this off their own bat to try and diversify the workforce and try and make a difference to the patient experience as well. Because the evidence is where you have a representation of healthcare professionals from similar backgrounds, the healthcare improves as well. So thank you for the invitation. This is a lot different to last year, and I've just said to Abdul, as you probably heard, I'm going to try a different technique. So what I'm going to do today is I'm going to answer the questions that were posed on the titles of the talk, which is about Manchester and applying there, and also talk about work experience and the challenges of COVID-19. But what I'd like is the audience to take part through the Zoom webinar chat. So I'm going to be asking you some questions as well, because that'll help you decide whether or not this is the appropriate place, this is the appropriate career for you. Okay. So the first question, does anyone fancy coming to Manchester? And what is the reason for coming to Manchester? And while yes, there's a yes there. Somebody Hamza wants to go there, Hafsa wants to go there, Zaina wants to go there. So lots. Whoa, I'm getting overloaded here. This is brilliant. So Manchester is in the house. So that's not a cool thing to say these days, is it? That's like a 90s thing to say. Sorry, I apologize for that. I'm a bit old. So why do you want to come to Manchester? It's a good university, close to home. Full body dissections, yes, we do. Okay, anything else? Close, local. Oh, it's far from home. Somebody wants to get out of their house. I love it. Love the accent of Manchester. Well, I'm from Yorkshire, so I take offence at that. Okay, and it's a very good university. So I'm going to sell Manchester to you now in a quick, short spiel. Okay. Brilliant place to study, well balanced. Offer small group sizes. Someone's been doing some reading. Yes, it is a big city, second only to London. I was going to say London is second only to Manchester. So it's the 6th best university in the United Kingdom. It's the 8th best university in Europe, and it's the 38th best in the world. Okay, now I'm actually quite jealous about that because I got rejected by Manchester. I went to Sheffield, which doesn't feature in this list. But anyway, I'm not bitter, am I? But every talk I mentioned that where I turned up an hour late. Don't turn up an hour late to your interviews. Well, actually, you can't because you're online. There wouldn't be much of an excuse. You got lost on the internet. Okay, why else is Manchester good? It is big. 11,000 students. 3,000 staff. Research is massive here. So if you are wanting to go down an academic career, £122 million a year is spent, is gained from research, the income that comes through. And Manchester itself. Manchester, you know, diverse, and I think this is what I love about it. I'm the co-lead for equality, diversity, inclusion here. We pride ourselves on the fact that we have a massive diverse population here. We have a high ethnic minority medical student population. We have 27 to 29% of our students from widening participation backgrounds. We really want to represent what Manchester is about. Okay, so I know I've noticed some people on the chat have already done some reading around Manchester. Does anyone know what you need to get into Manchester? You do need some qualifications. Yes. So that is what is required, and you do need some GCSEs, yeah, to do your A-levels. Yes, very good. Someone's been doing some reading. So when we talk about GCSEs, we're talking about grade 8s and 9s, aren't we? So the old A's and B's and everything have gone. Okay, so you do need that. So I think that getting into medical school is you need all the sciences. You can do if you're good at the arts like history, English, anything like that, then pursue that as well. Okay, so you can hear me now. Sorry about that. It's I'm in a shoe cupboard at the moment, away from the family. Although my 3-year-old is known to pop in, so if you remember that BBC interview, this may happen again. And she normally puts like a bucket on my head and things like that. Okay, so you're applying to Manchester. Okay, somebody mentioned Ucat, so the top third. Okay, how many of you are doing the Ucat very soon? Yes. Okay, a few of you doing it, so it's quite pertinent to you. And how are you feeling about it? Yeah, I can understand. It is tough. We won't make any issues about the fact that it is tough. These guys at Blue Peanut will help guide you, won't you?
Yes, yes, of course.
Yes, so they will help guide you, but there is also information on the Ucat website as well. Now, there was issues with the fact that we're in lockdown at the moment. So they are creating, test centres for this, socially distant. But in Manchester, we're also looking at the opportunity, if it's difficult for you to do at home. Ucat have said you can do it at home, but they're also offering the opportunity to do it in test centres as well. So ideally, if you can do it at home, but we understand that the home environment isn't that good, so then you can do it in a test centre as well. Okay. I think it depends. You're asking about the Ucat scores. I think it depends on the overall score, because it's all banded. Okay. For the situational judgment test, and for the Ucat, it's on the rating scale. So I wouldn't be so obsessed with the score as long as you're doing higher than the average. And I think the majority of our interviews are done through the Ucat. Okay. Yeah, I mean, that somebody's asking about the Ucas Cutoff as well. So there is a cutoff, which is the third, if you're in the top third. But Manchester's quite good in that if you miss out on that top third, our admissions team, they also look at things holistically as well. So they look at where you're from, what your predicted grades were, and other things as well. So I would still pursue it if you don't quite get the Ucat score. See if you can have a chance at it. Applicants, oh God, yeah, I've got it listed here because there's tons of applicants, yeah. So I think we tend to take about 900 to interview, but I think it's ridiculously large. Just bear with us. Can you still hear me?
Yeah.
Yeah, sorry.
Yeah.
Yeah, so it's nearly 3,000. So nearly 3,000 applicants. But the good thing about Manchester is it is one of the biggest university medical schools, if not the biggest in Europe. And this year, because of the coronavirus, We've increased our capacity by another 48. So we're heading into like nearly 450 students are going to be starting first year this year. So there is a high chance, if you look at it, of getting into Manchester. Yeah, as your colleagues have mentioned here, there's lots of information on the Ucat website. There's lots of information on the Manchester Medical School website as well. But if you think about it, 3,000 applicants, 900 go to interview, and then, over 400 get in. In the medical school selection criteria, number of applicants per interview, 3.8. So that's just the ratio of applicants to places offered, okay? GCSEs, I'm afraid Manchester is quite strict with it. Somebody's asking about the GCSEs, if you missed off on those. Unfortunately, it is the 7. It was increased from 5, grade 8s and 9s to this one, okay? Will the deferred students reduce the number of places? Yeah, so that is a good question. I've asked admissions team in the Medical Schools Council about this as well. Will the deferred students reduce the number of places? No, they won't, because we don't really want next year cohort to suffer as well. So there's this group of year 13s who have been given deferred place. Would still offer them a chance as well. I don't think it's fair for people to be punished just because of their age as well. So that shouldn't be a factor either. What's an EPQ? I don't know what that is, I'm afraid.
So these are extended qualifications
Okay.
that students can do during year 12,
Okay.
year 13 whilst they're in college, whilst they're at sixth form. And it is marked, there's essays involved, presentations involved, and it's like an added qualification which can enrich an application when they are made to university, basically.
Okay, cool. I don't think that is in the criteria, really, as far as I know. So, and I've not come across it. So when we've been looking at the forms and things, it's not something that's on my radar. But I suppose doing a project is good, isn't it? It's a good laugh. It's fun. You get something out of it, and it gives you an idea of what medical school is going to be like, because you are going to be doing dissertations as well. Okay. Okay, so deferred entry just means that you coming back in the year after. Okay. I didn't realize this experiment would go like this with so many questions. I thought it was just going to be like one person, and then but this is great. So some of them are a bit more specific to certain people. I'm sorry, I won't be able to deal with specific questions, but I can do some more general ones. Okay. I don't think looking at people with negatively with a gap year is an issue. If you've met all the criteria, a gap year could be fine. It might be for financial reasons where you want to, earn some money. It might be because you want to. Well, I was going to say travel the world, but in current COVID, travel around the local town centre. You might want to spend that time doing that. We don't look at it negatively, but use it productively. I think that's the most important thing. Okay, so I'm just going to move on. Okay, so once you've done the Ucat, in Manchester, it's a bit unique. I know some other places are doing this as well. We ask you still to complete the Ucas form, but we do a separate form. We do a non-academic form, and we look for targeted things, okay? So these are things like your team working skills, your motivation skills. We're looking at all these non-academic things that are really, really important for you, okay? Communication skills as well, okay, and caring experience. So if I say a caring role, what sort of things come to your mind? What sort of caring roles are you doing at the moment? Yes, volunteer at a care home, care work, elderly care. Okay. So, what we're looking for, the key thing is, from Manchester's perspective, is it doesn't have to be a medical caring role. So you don't have to be working in the hospital or in a GP surgery to be counted, but the quality's there. If you feel there, I'm not going to comment on all the ones that you've said. If you feel that it shows you out to be a caring person on the non-academic form. That will be tested in the actual multiple mini interviews. So you could be asked about your skills. You may have a scenario in a role that you probably worked in. So sometimes we do have a scenario that you have to do, and you have to problem solve where it is a care home. Okay. So I think anything where you're doing caring. Now, I think you have to really think about what entails caring. I think teaching is good in terms of it shows leadership, teamwork, and things like that. But does it really show the caring? I think you need to look at something where you're actually, you know, if you go back to the definition of caring for somebody, where you're actually tending to their personal needs. I think that's the important thing. So I think things like the care home and jobs like that are important. It doesn't have to be on a voluntary basis. Paid work is probably more recommended because you are doing this off your own bat as well. Okay. But I'm not negating from the fact that you're doing the teaching and all these things, because they can bring out all the other qualities that we're looking for applying to medicine. Okay. So the non-academic form, due to COVID-19, many of the extracurricular, will I still be able to refer to them during my... Yeah, I think you should, because somebody's just asking about COVID-19. And I think this is something we do need to talk about today, because your generation is meeting something that's never been faced. There's very few people alive since the last pandemic of 1918. So the question is, where we can't do anything at the moment. So I would say that is not an issue. I think you can refer to things you've done in the past. You can refer to things that you can do within the limits of COVID-19. Okay, I think we are going to be more flexible about this application. The Year 13 group that just went through had it okay because they'd already completed their forms and had done all the work experience. Your year group, I think, has the toughest deal of all, because you have not had that opportunity to excel. But don't worry, because you are all in the same boat. Very few practices are having people on work experience. Very few hospitals are having people on work experience. Very few places are allowing students to come on. So I think we have to be innovative. You have to think about what other things can show the quality of caring. You know, any kind of caring work. I think pharmacy is fine as well, because that is part of the caring role, because you will be involved in discussions with patients that come into the pharmacy as well. And if you feel there is things in college that is helping support people, is helping to make a difference for people, I think it's worth putting it in there. I would have a discussion with your college tutors to be able to look through that. Okay. So we'll talk about multiple mini interviews then. So as I said, the 900 students will come to interview in Manchester, but this year we've decided to do it online. So what we're looking at is the opportunity for you to do it from home. But I've had a chat with the admissions lead. If your environment at home is too busy, you don't have the personal space, there's issues with the rooms and things, we can look at alternatives. And we are looking at using schools and colleges to be a place for interview as well. So please get in touch. If you get offered an interview and you don't feel that it's fair for you, if let's say you're from a widening participation background, then we can give you a different opportunity. The other thing is, remember that we will ask you to use a background as well. So that way, you know, the biases that are unconscious from assessors and things like that won't count against you as well. So what we're trying to do is trying to make it as fair as possible for everyone. And then the multiple mini interviews will be the same. So it'll be 8 stations, which will be testing your non-academic form, okay? And that will check that the stuff that's on your non-academic form is accurate, and we'll check that in terms of asking about the form, We'll be asking about scenarios, assessing your communication skills in simulation as well with actors. So it's a very tough interview process, but it's very fair because you're going to have different people assessing you each time. Why not use the personal statement and ask us to expand on it? The reason why is the personal statement doesn't give a targeted sort of picture. So we in Manchester, we wanted to cover the key qualities that are needed to become a doctor. So if I ask you, what are the sort of the key qualities to become a medical student, what are the key qualities there? No qualities. Hardworking, empathy, determination, good. Caring, compassion, yeah. So you know the things that you need, okay? And that maps well to the the criteria that we're going to ask at, okay? And you need to have that list. The Medical Schools Council website has a lot of this this criteria there. So some questions I've just noticed passing by: memorizing the Quran whilst doing my GCSEs. Yeah, I mean that's fine. If you feel that does demonstrate organizational skills and time management, if you feel that it fulfills the criteria, then that's fine. Yeah, working with autistic children in a school is a perfect example of a caring role as well. So I think these are the sort of examples. So you have to just think outside the box in the COVID time as well. Okay. Okay. So yes, assertive to a degree. Yes, not too assertive, otherwise it gets scary for the tutors. Okay. So thank you. So yeah, everyone seems to have a good grasp of. So what we've talked about is the GCSEs, the A-levels, Ucat, the non-academic form, and then the multiple mini interviews. Okay, so you're coming to Manchester. Okay, I know some of you alluded earlier to why you picked Manchester as a potential choice. So again, tell me, why did you pick Manchester? Not this town, the course. What is so interesting about the course? And I can give you a bit of a rundown on why Manchester is unique. PBL, okay. Anything else? No. I love that, straight and blunt, yeah. So Sharia just wants the PBL. Research, yeah. Small group sizes. And you don't know many universities, so that's fair enough as well. Manchester came to your mind. Okay, this is the selling point of Manchester, okay? We do have problem-based learning, which, I'll be honest with you, is quite controversial. Some people love it, some people don't like it. The idea about problem-based learning is that you have a case, you dissect it, and you find out what your learning needs are, and then you go away and learn about it. Now, some people complain that you have to, it feels like a DIY course. It's not a DIY course because it gives you those adult learning skills of finding your own information and then testing it and assessing it as well. But Manchester isn't just about PBL anymore. We're one of the most forward-thinking in terms of the new approach to learning. And it's something you might want to consider when you're talking in the MMIs. It's called clinical reasoning. Okay, so Google that one. I know one of your colleagues mentioned about Googling Ucat. Google clinical reasoning. Okay, clinical reasoning is how you work as a doctor, how you think as a doctor. So it's about asking the right questions, problem solving. Now, I'm a bit ancient, so there's a guy called Dr. House that was the, I don't know if anyone watched House. He was like the perfect example of clinical reasoning. He asked questions, and then he tested it, and then he ended up with what we call a differential diagnosis. That's lots of potential causes. Yes, he's awesome, so I'm in the crowd. And from that, he narrowed it down, like a sieve, he narrowed it down to the most likely causes by history taking, that's talking to the patient, and assessing them through examination and investigation. So what we in Manchester want to do is try and bring that in, and it starts off in, like, I think even in the second year, I think there's emphasis on that. And when you go into your third, fourth, and fifth year, this becomes a key cardinal part of your learning. in Manchester also, the other big thing that we're bringing in is in the clinical years, we have something called theme case discussions. Can you say that again about clinical reasoning? Okay, how it relates to the course, it's an opportunity for you to think like a doctor. So rather than the old style of medicine that me, Abdul and Imran studied, this one's different, makes you think like a doctor from early on in your career. So you're doing the history, the examination, and then investigations to test your hypothesis as to what's going on. The other thing I mentioned is theme case discussion. This is quite innovative as well, and it's come from Harvard. So we've taken it from across the pond, and it's a new way of learning in the clinical years. What you do is you have to do the studying beforehand, okay? And then you test your skills by the end of the week as well. So it's called a flipped classroom, and it's something we do in 3rd, 4th, and 5th year. Okay, so the evidence is that way of learning is the best way of adult learning. Okay, so there are lots of teaching sessions as well on offer. So in 1st year, you have problem-based learning, and in 2nd year, and then you get start in 2nd year, introductions to clinical reasoning, and then 3rd, 4th, and 5th year has this new style of teaching, which is how to become a doctor, and the new way of learning, which is flipped classroom. Okay, problem-based learning is basically a case is presented to you, and from that case you dissect to see what are the important issues from that, and you're asking questions and things like that, and from that you find out what your learning needs are, and then you spend the rest of the time until the next session in reading up around the topic and then talking to your colleagues. Okay, integrated learning. So what integrated learning means that we're not like modules of certain subjects all the way through. Okay, so it's a mixture. So what happens is you get taught at the same time the anatomy, the physiology, communication skills, PBL, problem-based learning. You get it taught all together in an integrated way. So what you have in 1st year, you start off with something called essential skills to get you interested in medicine. Then you go on to the life cycle, cardiovascular, respiratory in 1st year, and then in 2nd year you do the mind and the brain, neurological stuff, and then you end up with nutrition and metabolism. So that's the 1st and 2nd year. And what we have is this thing called a spiral curriculum. So everything you learn in the first 2 years is then returns back in 3rd, 4th, and 5th year. So it's the opportunity to learn it, but with more of a clinical angle. Okay. So a typical week in Manchester, you have sessions for anatomy dissection, a session a week for phys pharm, which is physiology and pharmacology. You'd have a session a week on consultation skills, which is how to take a history or how to examine patients. So I was part of that group that created examination skills. We didn't have that before, but 9 years ago, we started creating examination skills in 1st and 2nd year. So you should know how, by the end of 1st year, how to do a cardiovascular exam and a respiratory exam, which really gets all the students excited about it. You also have ethics teaching. You also have lectures as well, which are like online for this year. So there are opportunities. Now, if you came to Manchester during the COVID time, there are 2 times when you have to come into the medical school, but it's still safe. And that's for your communication skills, and that's for the anatomy. Now, the anatomy at the moment, we're not asking everyone to do dissection, I'm afraid, because of the risks, but you'll still be shown the process of dissection. Okay. So if you've never had any experience with PBL, is there anything you could do? No, you don't. You just need to be aware of it, because college and university are big divides, different way of learning, different style of learning. So you don't need to have experienced it, okay? So what we have is in 1st and 2nd year, we have that spiral curriculum, all the knowledge and skills there. Then in 3rd year, Manchester is huge, so you get a chance to go to 4 bases. You either go to Wythenshawe Hospital, Manchester Royal Infirmary base, Salford Royal, or to Preston. So you have a choice there. You do get allocated. So I would just say to you, if you get into medical school and you have reasons not to go to a certain area, then try and get that in early on so that you don't go to a place you don't want to go. But they're all excellent places. They're all excellent places to study in. They're all excellent places of learning. Okay, so no one is going to miss out. The reason we have bases is because we have so many medical students. It's not available. Okay. It's just people do put their preferences, and then there's allocations done, but you may not get the one that you prefer, and then you need to have an explanation. Okay, so in third year we teach you about medicine and surgery. Okay, but you also have something called clinical debrief, which is quite unique to Manchester, and I think only a few medical schools do this. It's an opportunity to talk about your experiences. So you have GPs that teach you for 2.5 hours a week, and it's an opportunity for you to talk about what you've seen on the wards and what you learn from it, and it's that clinical reasoning again. It's quite unique. And then by fourth year, you do the specialties. So there's 8 specialties that you do. I used to lead on the GP block, which was a 4-week GP block that we created from scratch. And another unique selling point about Manchester is it's one of the first places that created a GP curriculum. So the things that you get out of it are tailored towards general practice rather than just medicine. And then into the 5th year, you consolidate your learning. You do some more general practice and medicine, and then you do some assistantships as well. Okay, the specialities, that's obstetrics, gynecology, pediatrics, psychiatry, general practice, ear, nose and throat, ophthalmology. Yeah, there's loads of them. Yeah, there's one group that some of the groups are like grouped together, so you only get a week of, let's say, ENT, a week of ophthalmology. The reason we have to do that is the emphasis is on the medicine side of things, but you also need to know these other these subject areas in undergraduate medicine. So it is a lot in the specialties. It's a busy year, but by the end of 4th year, you have the chance to go on elective. So that's an opportunity to go to either another country or somewhere in this country. We couldn't do it this year because of COVID, but that's an opportunity. So examinations, I think that's been asked a few times. Okay, so Abdul and Imran will know more about this than me because I didn't have the pleasure of Manchester. So you have semester tests. So at the end, in 1st and 2nd year, at the end of the semester, you have an assessment test, multi-choice. You also have what's called a progress test. So the progress test is taken by every student at the medical school together, and every year group has a different sort of pass criteria. You know, it's just an opportunity to see how you're developing as a learner. You also do something called an OSCE, so it's something to be aware of, objective structured clinical examination. That's an opportunity and it's integrated. What that means is you'll go into a station and there'll be questions and assessments around anatomy, physiology, communication skills, ethics. Everything that you've learned will be tested in these stations as well. Yeah, OSCE is like an MMI, but higher level and tougher. So that's the assessment 1st and 2nd year. And in 3rd year, again, it's more to do with the OSCEs and written assessments as well, like the progress test. By the time you're in medical school, there's a strong possibility we may have a national medical licensing exam. So the Medical Schools Council's been giving those descriptors. I think it's been delayed, but there is a possibility that if you get into medical school next year, you may have to do a national assessed exam to be registered as a doctor. So watch that space, okay? Would you recommend certain types of learning for different medical career paths? Wow, somebody's thinking advanced, aren't they? So surgical route, you can ask Mr. Goyal at 12:30. For general practice, the main skill, and you know, Abdul and Imran could correct me, I think the main skill is you have to be approachable, good listening skills, problem-solving skills. And the beauty of general practice is we deal with what we call undifferentiated presentation, where normally the first port of call when a student comes through the door, a patient comes through the door or comes online or on the phone. We also deal with complexity. So we have to look at the whole picture, not just the presenting problem, but all the other things as well. So it may come out in the media that general practice is quite simple, but what we teach in the medical school in these blocks that we do is how complex it is and how difficult it is without access to investigations and other tools as well. And it's not to knock any other career. Every career is challenging and exciting as well. So it's whatever gets you excited. And as Abdul mentioned, there is Dr. Rob will be able to give a bit more details there. Okay, so that is Manchester in a nutshell. Okay, what we also have is something called a portfolio, which is quite important as well, and it's something you could mention about why you're interested in Manchester as well. The portfolio is an opportunity for you to reflect on your learning. So what you have is, for the first 2 years, you have an academic advisor. I'm going to meet my first group, I think, in the next couple of weeks. So that academic advisor is available for you for pastoral support. So if you're having any issues and problems, but also to help you through the portfolio. And the portfolio is an opportunity to talk about like your first clinical experience, your first clinical skill, and to reflect on working in PBL groups and things like that. Okay, and it's quite a good opportunity for you to have an insight into your learning as well. I'm just having a look at that. Does your college affect your likability? Your college and sixth form should not be a barrier for you to get into medical school. I think that bias should be gone by now. It used to be an old boys club where there was preferential treatment, but the way we're trying to make it is unbiased. So that way, it doesn't matter where you're from. If you've got the academic ability and you've got the qualities that are mapped out, then there shouldn't be an issue there. I'm not sure about BTEC. I don't think Manchester do it, but I know other places do. So I would just look at that. Different universities for the criteria. Okay, research and preparation for the uni interviews. Okay, if there's one thing I would suggest you really get to grips with is the GMC documents. Okay, so like things like duties of a doctor. Okay, which is like the good medical practice. Because that's the sort of thing that we assess at medical school in your portfolio. We ask for evidence of like ethical practice, honesty, probity, probity, and things like that. So get yourself comfortable with what professionalism means and what all those things entail. Because when I do the interviews, that's the thing I'm looking for. Have you done some wider reading into the topic? Be comfortable with how to answer ethical questions as well. Don't ever give an answer that is one-sided, like I think red is the best color in the world and blue is rubbish. That's not right. You have to say there's some good things about red and there's some good things about blue, but weighing it up because of this and this and this, red is better. Okay, so in terms of the questions that you could ask in the MMI is, like I said, you could have a simulation where you have to act out how you have to be yourself, but there'll be an actor that'll be testing some of your skills. They'll ask you about your questions about your non-academic form, and there'll be some problem skills exercises as well. Okay, so the portfolio, someone's asking to repeat that. So the portfolio is something that you do get assessed on by the end of second year. It's there for the whole 5 years. You have an academic advisor to support you, and then you have the rest of the time is to reflect. You have to show evidence of like you're doing skills, and you're showing evidence that you are seeing patients as well. The other unique thing I forgot to tell you about Manchester is something that I was involved in. I used to co-lead on this. It's called Early Clinical Experience. So in Manchester, we try and get you out into the community and into the hospitals right from first year. And that's a great thing about it, because we want you to start thinking like a doctor right from the beginning of your career course. It's been curtailed a bit this year because of COVID, but we're still hoping in the second semester to send our students out to the community, to GP settings and other settings as well. Okay. Oh, brilliant. So Imran has mentioned Dr. Roche. I think that is a really key one for you to come. So as I've said before, Blue Peanut takes care of you, because ethics and good medical practice really come to that one. I mean, come to all of them, obviously, but Dr. Roche, I think if you're asking about MMIs, that's the key thing. You've asked about subjects. As I've said, it only has to be one of chemistry or biology, a second science, and then whatever you want to do as long as it's an A level, okay? Okay, so that is Manchester in a nutshell. You'll be spending your time mainly from third year on clinical environments, in clinical environments with clinical debrief as well. Okay, the elective program is normally a 6-week program at the end of 4th year, and it's an opportunity for you to go abroad or do it in the UK. We offer, for those of you who can't, for financial reasons, may not be able to go abroad, we offer a general practice elective where you actually get to study about medical education, and we teach you the skills of being a medical educator of the future, as well as time in a general practice. How do you react to unusual MMI role plays? Oh, right. Okay, I can't tell you the details for Manchester because I'll get in trouble for it. But just remain calm. I think that's the main thing. I think that's the skill, is maybe practice with some friends, okay? If your school don't offer any kind of opportunities, then practice with your friends and try and get that opportunity just to observe each other's reactions, because it is an act. The honesty is there, the truth is there that you have the qualities, but we're also looking at how you are, how confident you are without being cocky. So we're looking for that sort of fine balance of somebody who's confident but still professional in their approach. So practice talking, okay? I'm not sure about the extended version. I would discuss that with the admissions tutor about Ucat. The uni doesn't fund electives, I'm afraid, but nationally there are funding available, and you'll be signposted to that. Where you can go abroad, I went to Malaysia and Bangladesh. I didn't have much money, but I blew all my grant money there. I lived in really cheap accommodation, including one that was £1 a night, with no windows or any working toilet. So I wouldn't recommend my version, but you can go wherever you want. But there, we do take account of people may have financial difficulties as well. You can go to any part of the world as long as it's recognised by Manchester Medical School. The work experience, could you give info? So at the moment, work experience is on hold. So what I would recommend you do is the Royal College of GPs website. They have a virtual work experience opportunity. Okay, so maybe just go there and you can cite that. My practice takes a lot of work experience students. We're not taking any at the moment. I know Imran and Abdul, these guys, they're also have previously done that. But at the moment, it's not really safe for you to come as an extra person into that sort of learning environment. What we're saying is only essential workers should be coming into practice. So try and look at other virtual experiences. And there's lots of free sites around. So our National Medical Schools Widening Participation Forum partners up with a lot of sort of student organizations, and they offer you support in terms of interviews. There's one called We Are Medics. There's another one called Aspire Med. I'm just going to do some name drops there. Blue Peanut, obviously, as well. So there's lots of these organizations that are here to support you when you feel that the university may be a bit tied up in giving you that support. Okay, so they're just having a conversation amongst themselves. Yeah, so don't worry about COVID accept. Would they accept biology and chemistry? Yes, that is still the gold standard. I did that. I'm not sure about Imran, but I did biology and chemistry, and it was helpful for it. Aspire Med, yes. I don't know if you came there to their conference a few weeks ago. It was they're an amazing group of students from Birmingham and Glasgow. Okay, so for many places you have to be 16 though. Okay, so they just talk about work experience. Okay, do you want to know about the Manchester Access Programme? So the Manchester Access Programme is an amazing programme that we work closely with. So they provide an opportunity if you're from a widening participation background. So they have a strict criteria. Have a look on their website. If you type in UOM Manchester Access Programme on Google, you can access them. Okay. So for them, you have to come from a state school. You have to have got, I think it's 6 A's or A stars, so 8s or 9s at GCSE. And you also have to have parents that have never been to university. I know right at the beginning someone was asking about what if your siblings have gone to university. You still meet the criteria for the Manchester Access Programme because it's not your parents. Because I've seen it through the years, siblings have gone through the Access Programme. Okay, so that's not going to stop you from getting in there. If you're yeah, I think they're the main things that we look at for the criteria. But have a look on the website anyway. If you get onto the course, you will get some dedicated teaching and skills in terms of activities that they will do. So they will help you with the non-academic personal statement form. They'll also help you with things like the multiple mini interviews. So we're doing a mock mini interview, multiple mini interview in a few weeks' time for the current cohort of MAP students. We also offer masterclasses through the medical school, where we teach you about motivational skills, values and behaviours, and all the essentials to get into medical school. Manchester is quite unique as well. It's linked in with other medical schools. So if you're on an access programme in Kiel and a few other places, you can actually apply to Manchester with the same offer that somebody who's on an access programme would have, because those who successfully completed a dissertation at university level and completed the access programme can have a lower grade offer through the access programme as well. Okay, let me have a look. Can you still go if your parents went to university as mature students? I would discuss it with the access programme. I would discuss it with the access programme and see what they say. I don't know about that particular one. And again, about the Open University, again, ask them, okay? So the access programme is just for that year. So between just in year 12. The elective is only 6 weeks, and that's in fourth year of the medical course. Intercalation is not compulsory in Manchester. There are other places where there is a compulsory degree that you have to complete, such as Nottingham, which is integrated into the programme, whereas in Manchester, you can choose to do it. So if you've got a research interest, they do highly recommend you take a year out to do an intercalation, and there are opportunities for people to do that. What course do I take in university after my A's to become a doctor? So the course is called the MBCHB. That's the medical degree. You can either do a 5-year or a 6-year program. 5 years is the traditional one. 6 years is if you haven't got the right subjects in A level. You can go for what's called a foundation program. So medicine never closes the door. And I think that's the beauty of medical careers. You can still get in. You can get in through the foundation course. You can get in if you've done a degree as well afterwards. So there are opportunities for you. If you really think medicine is for you, then don't think that just because you didn't get in through your A levels, that's the end of the road. Okay. The access program applied to carers, I would see. I personally think it's something that they would consider, but I'm not part of the selection criteria for the access program. Poignant skills, not necessarily just for your application, not for your future. Poignant skill pre-med should be gaining. Yeah, I think the main skill is, if you want to be a doctor, you need to have, be hardworking. You have to love the subject that you're studying, which is, the physiology of the body, the anatomy of the body, the communication skills. You have to be happy with people. You have to have the skills to talk to people. You have to be a team player. The dangerous doctors, those who are not team players. We have to know that you can cope with the pressure as well, because it is a highly pressured job as well. So I would say use those qualities in life as well, okay? Right, I didn't realize Abdul ran so many questions. This is great. I only thought of the idea 5 minutes before we started. I ditched my talk and went down this route instead. Good,
this is excellent. Thank you.
Okay. Yeah, so I apologise to anyone if I couldn't answer your questions or I couldn't see it. It's just I'm getting inundated here. Can you apply to other cities for master? Yeah, so you can apply to other access programs if you live in another city. So have a look at your university-specific website. There's some amazing access programs around the country. I think Brighton is nationally famous as one of the best ones. Manchester as well is one of the gold standard one, and there's some others as well. So there will be there. And if you can't get an access program, look at the student widening access societies. They're doing loads of activities all over the place. There's also summer schools that are organised by the Medical Schools Council. So last year, we did a 1-week intensive summer school in Manchester. I think there's some online summer schools happening around the country this year, which is funded by the Medical Schools Council, which is like the umbrella organisation of all medical schools. You can't apply to foundation as well as the main medical degree because it's different criteria. Psychiatry is a speciality in itself, similar to general practice. You do 5 years of medicine, 2 years of foundation year, and then you start specialist training, and it can be up to 5 to 7 years depending on the speciality. But psychiatry is a medical course. So you're a doctor who then becomes a specialist, like a surgeon, a GP, a physician is a psychiatrist as well. I can't give you any information on dentists apart from my brother-in-law is a dentist and he's enjoying it. And he does private dentistry, so he drives some flash cars. That's all I can say. He came from a WP background, but I would still say medicine's great, okay? Unless you want that flash car. So what subjects I did for A-level was maths, chemistry, biology, okay? But that was many, many years ago, okay? Yeah, so specialism is after the foundation year. So the foundation year is blocks of 4-month placements. So you get 6 in a 2-year period of like medicine, surgery, general practice, psychiatry. There's lots of options there. And that's just to give you a flavor of being a doctor before you become a specialist. Wheelchair user, no, there should not be an issue, and we would strongly encourage you to apply to medicine. That should not be a barrier. So like I said, I'm the co-lead for equality, diversity, inclusion. If there are any issues with disability, we have got a disability support unit. We have lots of people that can help you as well. So definitely apply to medicine, okay? I would not count that as a barrier. The age is not a barrier either. When I was at medical school, I don't know about you guys, but the guys in their 40s doing medicine as well. So there is no age limit to worry about, okay? So as long as you fit the criteria. The only thing is, if you get older, you may have to pay for the whole course. So you just have to have that financial security to help you. But if you're from a widening participation background, if you have financial issues, don't worry about it. There are lots of bursaries and scholarships and things that you can access. We have a very, very strong pastoral support unit here at the medical school. One of my friends, Pip Fisher, is the director for student wellbeing, and we've put that as a priority now, okay? So we will be able to signpost you if there are any financial issues. You shouldn't be impaired because something outside your control. Okay, if it's more about you not doing the studying and you can't be bothered, that's a different matter. But if it's because of things outside your control, there are hardship funds that you can do. You can specialise in multiple disciplines. I'm a GP for 2 days, and 3 days I work at the medical school. So my speciality is education. You can be a GP trainer. You can have you can work as a specialist interest in like cardiology, the heart, and other areas as well. There are multiple disciplines you can do, but you need to just try and get the first qualification. Become a specialist in something first. Okay, neurosurgeon. I don't know the exact step, but it's a great place to study for neurosurgery. Manchester, Salford Royal is up there as one of the best for neurosurgery. So I think you're coming to a really, really good area if that's what you want to specialize. The dyslexia shouldn't affect your chances. So if there are issues, just there will be things mentioned in the forms. So there will be things to support you through that. That shouldn't be a barrier. Okay, we can make arrangements to help and support you. Ophthalmologist is as before, it's a specialist training program after your foundation year, and there's a great eye hospital here in Manchester as well. Okay, I mean, year 12, I haven't done any work experience because of COVID. I have no chance of working. Will that affect? No. Like I said, try and think about all these virtual work experiences. Look at these organizations that are on social media, you know, Instagram and Facebook. Don't go to the ones that you have to pay for, because I think that's really, really unfair. I'm passionate that, you know, for widening participation, that it should be free access, like, you know, Blue Peanut has given you today. I think it's really, really important that people shouldn't be making money out of you for your future career. Ethically, I don't feel comfortable with it. But like I said, those organizations I've mentioned and the local medical schools, they have so much to help and support you. Like Blue Peanut has given you an amazing insight to their conference into medicine. These are the sort of things you should be tapping into. Come to these organizations. Come to another Blue Peanut event. Sorry, I don't know if you're going to do a follow-up or anything like that, but if they have any follow-up, just stick with these guys. They've got a very, very good track record as well. Okay. Yeah, Wythenshawe Hospital does. Plastics is very good as well in that area. Cardiothoracics is really big in that area. What else can we do to secure our place in university? I think you're doing all the right things, Pania, when you're asking about what you need to do. So I think it's all falls down at the end, because I think if you get all those ticked off, it all falls down on the MMI. So that's what I'm saying. Try and find out places where they will help support you in preparing for the MMI, because that is the moment when you will be able to show all the qualities you have. Oh yeah, Dr. Glaucom Flecken, yeah, he's famous, isn't he? Yeah, I recommend him as well. He's hilarious. Cardiology, extracurricular activities. I wouldn't worry about specialism at the moment. You're going to change your mind, okay? I don't know about these guys, but I was changing my mind all the time. Depends what specialty you're in. On the wards, you eventually decide what you want to do. So don't narrow your vision at the moment. And I wouldn't say that at the moment. You could say you're interested in cardiology, but don't narrow it down, okay? Can you still continue with the course? Yeah, so unfortunately, we would ask for those specific GCSEs. That's in Manchester. I can't say the same for other courses. So you may need to retake those particular GCSEs, okay? Because it's not counted, I'm afraid. Okay, it just doesn't work. 7, okay, for bio and chem. Oh, okay. Have a look at the website. Okay. I think we're looking more at the 8s and the 9s, but have a look at those, because I think if you have 7 in other subjects, 8s and 9s in 7 other subjects, you should be okay. I think it's maths and English is the criteria, but have a look at the website yourself. Will uni be slightly more lenient in terms of how much work? Yes, definitely. And in terms of EDI that I work in and work experience that I'm in widening participation, I've made it a massive thing that we shouldn't be making your life difficult in this situation. We need to have that understanding. Okay, we still need the doctors of the future. So yeah, that shouldn't be a problem. And keep an eye out on the website to see the latest advice as well. Yeah, reading wider, just the medical literature, the websites and the news. Look at what the hot topics are. For example, COVID-19 is a big hot topic, and just shows that understanding the GMC. Okay, okay. So I'm going to have to leave it there because I realise Mr. Goyal is here as well, and I'm due to finish. So I'm going to round off. Sorry, I couldn't answer everyone's thing. Like I said, I only just came up with the idea a few minutes before we started, but I love the fact that you're so passionate about getting into medicine, so committed to wanting to get into medicine. And I think if you maintain that, and this is your desire, I'm sure you'll succeed. But don't be down. I think that's the main thing. Don't be down if you don't get into medical school. It's either that you'll find a great other career, which will also make a massive difference to other people, or you can have opportunities later in your life. So don't count it as the be all and end all. You're young. You've got the whole life ahead of you. Don't make this like a reflection. If you don't make it, don't make this a reflection of failure. Okay. Some of the best medical students that I've taught, some of the best doctors I've had, did not get into medicine first time. Some did arts degrees, some did degrees, full degrees, some you completely out because of control, things outside their control, messed up on their GCSEs, their A-levels, but they retook and got chances afterwards as well. So I would not worry about not getting in. But if you feel you can make that difference to society, that small difference, okay, it is still a massive thing. If you feel you've got those qualities of motivation, of teamwork, of that desire to study and learn and excel in terms of your knowledge and your skills, then I think medicine is the career for you, and you will be great. And we need you in Manchester, and I'm biased there, but we need you in Manchester because we want the Northwest to have the best doctors here. Okay, thank you for your time, everyone. Apologies I couldn't answer everyone else's questions.
Thank you very much, Enam. That was a fantastic session. Very interactive, very novel, fantastic. Thank you very much indeed. I think you raised a very important point. We come across this all the time in that people, and I had to field a number of calls this summer, and I'm sure Imran would agree as well, people calling us and almost seeing themselves as failures for having to go into do, say, another undergraduate degree and so forth. And time again, I'm saying to young people that actually, do you know what? This is do not see yourself as a failure, because going to university, doing another degree. It will enrich you as a person. It will make you stronger. And you're absolutely right. Some of the brightest colleagues we've worked with as medical students, and to this day as professionals, and they've actually done degrees before coming to medicine. And indeed, you know, I was with Australian students just yesterday on Zoom. And as you know, over there, most of their medical students actually come through having done a foundation degree. It's the same in the US, same in Canada, and many, many other countries where medicine is actually a postgraduate degree that people do. So do not count yourself out of the game just because you go on and do something else or things don't quite work out first time round. Dr. Haque, again, on behalf of all of us here, thank you very much again for joining us this year. You're fantastic as usual. You have a wonderful day. There's lots of comments coming in. People are thanking you as well. So again, many thanks. You take care.
Thank you, and thanks for the audience. It's been a pleasure chatting to you. Very, very enthusiastic, and all the best in your applications. And thanks, Blue Peanut, for the invitation. See you, everyone. Bye-bye.